Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. It's interesting to hear. I think what you're describing is something I hear from a lot of my patients as well, is that a couple of days after their chemo, that tends to be when they hit, they kind of hit that trough of how they're feeling.
Yep.
And then they actually have quite a bit of good time.
Yep.
And then over time, maybe the symptoms of the chemo are cumulative. Those get a little worse, and they can get gradually worse over time. And not for everybody, but for those who are having symptoms from their cancer, they'll feel a lot better. So it's an interesting trade-off between the cancer typically most cancers will respond to chemo, and the symptoms from the cancer tend to get better.
Yep.
So for people who actually have a lot of cancer burden and that's causing them to feel really bad, sometimes they'll feel better on the chemo. So we see that too.
Interesting. I didn't know that.
Yeah. And then to your point, this fatigue's a common one. And people ask me frequently, what are the side effects that I'm going to get from chemo, or what are the side effects of chemo? And fatigue is probably the most common one across different chemotherapies, very common. Nausea is also very common. For lung cancer, at least, and many other cancers, I don't expect people to vomit. So our anti-nausea meds have gotten so much better over the last, 20, 30 years. And we can now give really aggressive anti-nausea meds with the infusion. People are sent home after the infusion with nausea meds that they can take. They have a number to call. If their symptoms are bad, we can figure stuff out. So there's a lot that we can do. So for anyone who is worried about the symptoms they're going to get, you're not stranded. And if you have those symptoms, call your provider. For me, I would much rather hear about it. I am far more distressed at the idea of you vomiting or really being sick for a couple days than the page that I'm going to get to help. So definitely talk to your healthcare provider.
The biggest piece of advice I give from a patient perspective on nausea meds in particular is, as I said before, like I hated taking medicine. My mindset had to shift, and I was told, stay ahead of your nausea. Do not wait to feel super, super nauseous. Like just any inclination of a little bit of nausea, take the med. Just succumb to it and take the med.
And these meds don't have bad side effects.
Right.
So there's not a lot of downside. If you take it and you didn't need it, it's not going to be a problem, but it's way harder to catch up.
Yep.
And those are the times where sometimes you'll have to go to the ER to get it as an infusion, or, we'll have to figure something else out.
Yep.
Great point. The other side effects that people hear about and do occur are the numbness, tingling that can happen with certain chemos, because it can cause damage to the long nerves. So people tend to get it in their fingers and toes because those are the longest nerves of the body. So they get a little tingling there. And there are products out there to cool the hands and things. There's not a lot of tremendous great data that they help everyone, but for some people, they do find them helpful. So it's something to talk about. And hair loss. Not every chemotherapy will give hair loss. We're fortunate in lung cancer that most patients don't get hair loss. Other cancers like breast, hair loss can be common with some of the regimens they give. And for that, talk to your doctor about cooling caps, those kinds of things. Similar, there's not a lot of great data that they help everyone prevent hair loss, but these are the tools that we have. So I think it's worth having that conversation.
And thanks for the reminder on the tingling on hands and feet, because it wasn't that prevalent for me. Obviously, I forgot about it, but it did happen to me in my feet. And I was doing acupuncture regularly. I'm very fortunate at my cancer institute. They offer discounted acupuncture. And so acupuncture helps so much with my neuropathy. I don't know the science behind it. I don't know anything other than it worked for me. So I did have some weird tingling in my feet for sure, especially in my toes. And the acupuncture just immediately eradicated that. So that was great.
Yeah, it's interesting because there's a lot of data, or there's a lot of information about there about things that might help. And we actually do have some studies about acupuncture being helpful.
Mm-hmm.
A lot of the ideas that go through the cancer community are anecdotal, as in someone tried it and it helped, and you don't know, you know, was that symptom going to get better anyway? But acupuncture, we actually have some data on. So that's a good one to talk to your provider about. I'm happy it helped you, and we have data supporting that. Um, other things, there are more rare side effects to chemotherapies, like the really bad fevers, chills. Those are usually signs of infections. So if
Mm-hmm.
someone's getting those kinds of things, definitely talk to your doctor. But to your point, Samantha, just like you're in the infusion clinic, if you start to feel different, chemotherapy can do weird things. So
Yep.
even delayed, even at home, if you start to feel different, like you gotta go ahead and just call. And it's not an inconvenience. This is their job. They're there to field your calls. They're there to help you triage if it's a problem or not. Not a problem. Anyone who's going through chemo has a big support team with their infusion group and their oncology group.
I have two things I want to bring up with you because I was not told about this stuff when I was going through treatment, and people might be interested. Number one is immunity. And what I mean by that is, I think when I first went into chemo, I believed it would tank my immune system. And so I would be susceptible to like viruses and colds more. And like, so I couldn't be around family members, or I had to be careful where I went. I was fortunate, or maybe it was just the chemotherapy I was on, where I never got sick from exposure to other viruses and colds and stuff. But that's just part of daily life, right? So I guess my question for you is there a misconception around that it tanks your immune system and you are more susceptible to things, or is that really a thing, and do people need to be careful and cognizant of that when they're going through treatment?
Yeah, it's a great question, very relevant question. And because there are so many different types of chemo regimens and so many different types of cancers, that the answer is it depends. There are cancers where the standard treatments we have are probably going to wipe out the immune system, and someone will be very vulnerable. So there are cancers that affect the immune system so much that we actually put them on antibiotics, and we put them on medicines to prevent them from getting infections because their immune system goes down so much. Now, for many cancers, it's not that severe, but we do have good evidence that for a lot of chemotherapies, it does blunt the body's immune response. Now, to the degree that the average person would know it, maybe not, but it will probably dampen one's ability to generate antibodies, to react to vaccines and things like that.
Mm-hmm.
So it is definitely a consideration when I'm counseling my patients about getting vaccinations. I want them to get the vaccinations before they get the chemo,
Mm-hmm.
because chemo can affect those kinds of things. But do you have to live in a bubble? No. I
Yeah, and I
want,
kind of thought that.
yeah, yeah. Well, and there are some circumstances that the risk is really high,
Yeah.
and it's not everybody. And
Yeah.
if that is, if that is you, if you're the person who has that really, really high risk chemotherapy for infection, then your doctors will tell you, and they're going to be really clear about the pills you need to take to lower your risk of getting infections, the signs and symptoms of your infections, and what to do. Because yeah, I've had this same conversation with a lot of patients,
Mm-hmm.
and they say, oh, I know I'm on chemo, so I don't go to the grocery store. I don't leave
Yeah.
the house. And it's like, no, I want you to, like,
Yeah.
don't go licking doorknobs. But like, like I do want you to be active,
Yeah. Yeah.
and because the trade-off there, to your point, you were feeling really fatigued.
Mhm.
And one of the best things you can do for fatigue is exercise.
Yep.
So I counsel my patients for strength training, actually. Make sure they do some weight-based stuff, mostly a lot of lower body things.
Mhm.
And that's going to be a hard thing to do in isolation. Like it's boring. Like hiking is probably one of the best things you could do.
Yep.
But you can't do that and also be really worried that the second you leave the house, you're going to get a virus that's going to, completely tank you and send you in the hospital. So I
Yep.
think for most people, they can live their life with reasonable precautions. If you go out, wash your hands, keep some hand sanitizer or something. If you're at a large area where you're expecting someone might be sick, it's socially acceptable now to wear a mask. That's a reasonable thing to do, but you don't have to live in a bubble unless you're one of the few people who do really, really have a severe immunocompromised state. And that's not terribly common.
Yep. That's super helpful to know because, yeah, that was one of my big misconceptions too. And then the other one that I just happened to find out through other friends going through treatment that no one ever talked to me about this. And I don't know why it's not talked about because it should be is when you're going through chemotherapy, you are, I don't know what the appropriate word is, but you're like toxic for a certain amount of time. In terms of like going to the bathroom and like blowing your nose, and no one told me that like maybe you shouldn't be sharing a bathroom with your spouse when you're like X amount of days into your treatment. Or like making sure your dog doesn't lick your face or and I also randomly learned that apparently if you have a septic tank as part of your house, that if you're on chemotherapy you have to get the septic tank flushed on a regular basis because you'll actually destroy your septic tank. So that is not a disclaimer in the handbook I got. So
Yeah, I can't say I've counseled patients on septic tank management. I think you've taught me something today. Where did you hear that?
yeah. Some Instagram reel, but we actually Googled it and it's a
It's
real
real.
thing. It's a real
Yeah.
thing. And in fact, your septic tank company will come out complimentary and like clean it out if they're a nice company, I guess, every month because essentially all of the good chemicals that are in your septic tank get destroyed by you excreting out the
Hmm.
chemo, and it can eat away at your septic tank and cause tens of thousands of dollars worth of damage. So who knew?
These are the things that the doctors don't want you to know. It's all about how you maintain your septic tank, really.
Yeah,
Yeah, we're
apparently.
very vocal about all the medicine stuff, but it's septic tank management. That was the trick. This one
So
trick doctors hate.
I genuinely had no idea that when I went to the bathroom that, obviously it makes sense, right? What you're excreting out is the toxic substance of the aftermath of your therapy, but like no one told me that. And like when I found out, I instantly got terrified. Like, am I poisoning my husband? From using the same
Hmm.
bathroom. So I'd be curious to get your thoughts on that because I know different chemos are different. So
Yeah.
like the first one I was on, I think it stays in your body for 3 days. The one I'm on now is 7 days, which is a really long time. But again, never told about this. And I think people that have families and pets should be aware.
Yeah, I think to your point, the risk is probably higher for pets just because it's a dosage thing.
Yep.
And it does change from chemo to chemo.
Yep.
So there are some chemos that we're more worried about. And, for those listening, the oncologist, the pharmacist, those people will tell you
Hmm.
and ask. If you don't hear about it, ask if this is something that you need to limit your exposure to your loved ones or your pets.
Yep.
Some chemotherapies actually might change the coloration of your secretions, your tears and things like that, your urine.
Hmm.
So if you do start noticing that your tears are turning red or something like that, you should call about that. That's a thing to bring up, I think. But yeah, I mean, the answer to a lot of these questions is it depends on the specific chemotherapy.
Yeah.
But yeah, these are real concerns. The risk is, from human to human, adult, is probably not huge, but not zero.
Yeah.
That you could have some sort of toxicity or some reaction, especially since you don't know what other people are allergic to. You don't know those kinds of things. So good things to definitely be aware of. Yeah, I'm
Yeah,
curious if
I am. I hope now I save people who listen to this. I'm hoping that I save them tens of thousands of dollars if they have septic tanks. So
all of our
that's
promotional material is going to be septic management companies. Like, what is
that's
this
my
podcast?
that's my PSA for the entire episode is if you have a septic tank, make sure you get it cleaned regularly.
These weren't the takeaways I was expecting, but it's gold. Yeah, I think.
Yep.
Yeah. Man, that is too funny. Well, I think we've covered a lot of ground today. Any last thoughts on your end, Samantha?
I mean, my main thing really is probably, when you have any questions or concerns or dread or fears, talk to your care team. Google is your best friend in some cases and not so much when it comes to cancer stuff. It can provide a lot of fear and misconceptions that aren't necessarily true and accurate. So I would say for you to be fully prepared on what you might be going into, talk to your care team, and they might provide you booklets, but having actual conversations with any fears or questions you might have, don't be afraid to ask them. Even if it's a list of 20 questions, just ask them all. It will make you feel better. And then just feel like when you go into that first chemo session, take creature comforts with you, take family members if you can, or a friend, or something that is comforting to make you feel less alone and distracted, because it is a very big deal to go through. And if people say that they're not scared of their first chemotherapy treatment, I think they're lying, because it is scary. So the more resources and information you can have behind you, the better to make you feel comfortable.
Yeah, I couldn't agree more. And for anyone who's looking at chemotherapy in their future, keep in mind the medical team is also, this is what they do, day in, day out, every day. The infusion nurses, they know what they're doing. You're going in there, you're not there alone. And there's always someone you can reach out to if you have questions, day or night. So not only are you going to have your family there, hopefully friends there, and if not, if you are going into a chemotherapy session, perhaps it's your first one, there's also patient advocacy groups that, for whatever type of cancer you may have or your loved one may have, try to find a patient advocacy group that is, rallied around that cancer type. And those are people who might be able to give you some insight as to what you can expect, or even provide some contact of someone you can talk to. So in so many ways, you're not alone, because I think that's something that gives a lot of people concern, or the fear of the unknown. And it'll get better. That'll get better. Okay. Well, with that, I think we'll close. Thanks everyone for tuning in. And please remember to like and subscribe. And then you can visit crackingcancer.org. 100% of our profits go to cancer research. So liking and subscribing is the way we generate funds. And we will continue posting more content to answer all your questions. All right. See you next time.
Thank you, everyone.
Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.